presentation. I do want to make a couple new announcements for the year. We are going to be welcoming two new subject matter experts, Dr. David Kursky. Dr. Kursky is from the Northeast region. He is with the Tennessee Department of Health, and he does serve adult patients living with hepatitis C and has an extensive background in treating adult patients living with hepatitis C within our health department settings. And then also Dorinda Harris, which is a nurse practitioner from the Southeast region. She is also with the Tennessee Department of Health. And Dorinda joined us about a year ago, I think. Dorinda, correct me if I'm wrong. But her primary focus has also been treating adult patients living with hepatitis C. And Dorinda has attended a multitude of echo sessions, and we really, really appreciate Dorinda and all her efforts. And Dr. Kursky, I personally worked with Dr. Kursky in the Northeast region, and he has an extensive history, as I mentioned before, with also treating patients living with hepatitis C in our health department setting. So we want to welcome them. And I think we can go ahead and get started. As I mentioned at the very beginning, our session is going to be about the basics of hepatitis C. And so I'm going to go ahead and turn it over to Melissa Moon.
Hey everyone, good afternoon and welcome to our first Echo of 2025. So there are no conflicts of interest to disclose. Today's objectives are to identify the different types of viral hepatitis, explain transmission of hepatitis C, discuss prevention of hepatitis C, and then, of course, identify barriers to hepatitis C treatment. So the term hepatitis is inflammation of the liver. So hepat is liver, and then itis is inflammation. This can be caused, though, by excessive alcohol use, drugs and toxins, chemicals, exposures to a virus, a fatty diet. So different things can cause viral hepatitis. Definition of viral hepatitis is the inflammation of a liver due to a virus. So each type of viral hepatitis varies in transmission, treatment, and recovery. So we have to identify what type of viral hepatitis an individual has so we know how we treat and respond to that individual. Symptoms of each type of viral hepatitis can include nausea, vomiting, fatigue, jaundice, which is the yellowing of the skin and eyes, gray-colored bowel movements, loss of appetite. Some individuals will have several symptoms, but there are some may not have any symptoms. It'll just vary on their case of viral hepatitis. So again, like I just said, symptoms may or may not be present. So hepatitis A is an RNA virus, and it is spread through the fecal-oral route. This virus can be prevented by a vaccine. It's like a two-part series vaccine. And an individual who contracts hepatitis A, they typically resolve it on their own. Very rare is it fatal. Hepatitis B virus is a DNA virus and is transmitted by sexual contact or contact with other body fluids, including blood. It can be transmitted from pregnant person to baby. This one is also vaccine preventable and it's treatable but not curable. So there's a treatment for hepatitis B, but not a cure. And hepatitis A, there's not a treatment. You would treat the symptoms that an individual has. With hepatitis C, this is an RNA virus and it's spread through the contact of blood or sexual contact if there's a blood-to-blood exchange. This is the most common blood-borne pathogen in the United States. It can be transmitted from a pregnant person to baby. It is not vaccine preventable, but it is curable. This slide here shows we have a flyer that we use at Tennessee Department of Health. We share this with clients that come into the health department to get tested or our navigators, when they're out doing outreach in the community, they will use this flyer. In our community-based organizations as well will use this flyer to give out to clients, but it just explains the ABCs of viral hepatitis, what each one is, how it is spread, how it's prevented, if there's a vaccine, if there's a treatment, if what symptoms they could cause, and how do you test. So this is a pretty neat flyer with the quick facts for hepatitis A, B, and C. With hepatitis, the acute stage is that first 6 months, and then a chronic viral hepatitis case is the lifelong. This is when an individual has gone past the 6 months and the virus is still in the body. There is no chronic illness with hepatitis A, but people with acute hepatitis B, C, or D can clear the virus on their own. But if they don't clear it on their own, it would go to a chronic. So chronic hepatitis B, C, and D is what can lead to serious liver problems. So hepatitis C virus is the most common type, or one of the most common types of viral hepatitis in the United States. There is an estimation between 2.4 million to 4 million people living with hepatitis C, and that was between 2017 and 2020. Individuals aged 20 to 39 have the highest incidence of acute hepatitis C in 2022. And in 2022, rates of hepatitis C was highest among non-Hispanic American, Indian, Alaska Native population. With this slide, you can see, so we'll talk about like the acute and chronic, and then also the symptoms. So this first diagram shows that 70% of individuals that have hepatitis C move to the chronic stage, where about 30% of individuals their bodies fight it on their own and they resolve hepatitis C without treatment. The other diagram shows that about 70 to 85% of individuals with hepatitis C are asymptomatic, and then about 15 to 30% have symptoms. So with hepatitis C, an individual may or may not experience symptoms. If you remember just what I just said a minute ago, 70 to 85% do not have symptoms. So only about that 30% would have symptoms. And then if they do have symptoms, they would have like the dark urine, clay-colored stools, fatigue, joint pain, loss of appetite, the nausea, vomiting, abdominal pain, and the jaundice, which again is the yellowing of the skin or eyes. People with chronic hepatitis C are usually asymptomatic, but they may have chronic fatigue or depression. But this is a reason why hepatitis C could be missed for so long, because if an individual doesn't have symptoms, they don't typically go to a provider to get checked out. This this slide shows the acquisition of hepatitis C. So someone who contracts hepatitis C, that it takes about 8 to 11 weeks after exposure to show the antibodies, but it can take up to 6 months to show antibodies. So if an individual gets tested too early with just an antibody test, it would not reflect an accurate positive or negative status. If a person has a positive hepatitis C antibody, they will remain positive for the antibodies for the rest of their life, even once they get cured of hepatitis C, or if their body was to fight it off on their own. The RNA is different, as if you were to test somebody who has hepatitis C right after they contract it, the RNA will show up within 1 to 2 weeks, where again, the antibodies could take up to 8 to 11 weeks to show up on a test. The RNA, though, is the test that tells us if somebody is living with hepatitis C today. We have this postcard here with Tennessee Department of Health that, again, we use in the field to go along with outreach when we're doing testing or just education out in the field. And this breaks down the testing. So it tells an individual, like if you get tested for the antibody, what the results mean. If you get that negative, you most likely don't have it. But if you've been exposed recently, you need to get retested. If you have a positive result, you would need that second test, the RNA test, to see if you have it. And then it breaks down the RNA test. If it's negative, they likely do not have it. They've cleared the virus on, or they've been cured, or they've been tested too soon, which again, an RNA takes about 1 to 2 weeks to show up. If they have a positive RNA, then that tells them you have hepatitis C today. Let's get you linked to a provider to treat your hepatitis C. So with this, you can see what it looks like when someone contracts hepatitis C on their liver. So you got that normal liver, and then again, 55 to 85% go into the chronic hepatitis C, and then 20 to 30% of those individuals go to cirrhosis, and then we see the liver cancer or the end-stage liver disease. Now, this again is typically more of a slow progressive disease where if someone has HIV and hepatitis C, this will progress more rapidly. It won't take, it takes very much less time. And this demonstrates the time frame. So you've got someone with a normal liver, they've contracted hepatitis C, they have now moved, their body didn't fight it off or resolve it on its own. So now they're in the chronic hepatitis stage. In about 20 to 25 years, you'll see cirrhosis. 25 to 30 years, you'll see the liver cancer or the end-stage liver disease, and ultimately then death. But again, with HIV, this time frame is much shorter. Hepatitis C nationwide, we have 9 states that represent more than half of the people living with hepatitis C nationwide. As you can see, Tennessee is one of the 9 states. So the populations that are vulnerable to hepatitis C are individuals that are classified as baby boomers that were born from between 1945 and 1965, individuals that have a history of injection or intranasal substance use, someone who received an unregulated tattoo or piercing, born to a person living with hepatitis C, that vertical transmission, uh, receiving a blood transfusion or organ transplant prior to 1992, as our blood products were not screened for hepatitis C until 1992. An individual who is HIV positive is vulnerable to hepatitis C, history of sexually transmitted infections or multiple partners, a past or present incarceration, and then also sexual contact with a person living with hepatitis C. So, how is hepatitis C spread? It is spread through sharing of needles, syringes, other equipment used to inject or snort, your snorting straws, your cookers, your water, anything that could be used to use that substance. If that blood has got in that, it could be, that's how hepatitis C could be spread. Sharing or contact with objects that even have invisible amounts of blood on them, needles, syringes, the glucometers, razors, toothbrushes, nail clippers. So just because like the blood is wiped off, if it was not properly sterilized, the virus is still present. You can also transmit it through unregulated tattooing or body piercing. So sharing of the tattoo needles, the tattoo ink, the piercing needles. Again, the blood transfusion or organ transplant before 1992. birth to a person with hepatitis C, and then condomless sex with a person who has hepatitis C, even if they are not aware that they have hepatitis C. So the recommendations for testing for hepatitis C as of 2020. So the universal screening, all persons aged 18 or older at least once in their lifetime, and all pregnant persons during each pregnancy. And then one-time testing regardless of age among persons with recognized conditions, such as persons living with HIV, and individuals who have ever injected drugs or shared needles, syringes, or other drug equipment, persons with selected medical conditions such as receiving hemodialysis, prior recipients of transfusions or organ transplants, healthcare, emergency medical, and public safety personnel after needle sticks, sharps, or mucosal exposures to hepatitis C positive blood, and then children born to a birthing parent living with hepatitis C. And then the recommendations are to do routine periodic testings for persons with ongoing exposures, such as individuals who are currently injecting drugs and they're sharing needles, syringes, or other drug preparation equipment. And then individuals with selected medical conditions like receiving hemodialysis. And then they also, anyone who wants to get tested, they say test. So thankfully, with hepatitis C, there is a cure. The success rate is 95 to 98%. The treatment or the cure takes 8 to 24 weeks with direct acting antivirals. The type of medication and duration is determined by the medical provider, and they will base that off of the fibrosis staging, presence of cirrhosis, allergies, or comorbidities. This treatment is oral medication and it's taken daily. And then there's typically minimal side effects, fatigue, headache, nausea. Sometimes we hear, because I'm out in the field quite a bit, and individuals will say, "Oh, I took that treatment and I had no side effects." Or some will say, "Well, I had a headache through it, but it was worth it." And then there are some who have more side effects than others. It just varies from person to person. The common direct acting antivirals used to treat hepatitis C. So bear with me, I am not good at pronouncing medications, but we've got the sofosbuvir, valpatisvir, which is the trade name Epclusa. Then you have gliclapivir and parbrentasvir, and then we also had ledipasvir and sofosbuvir as well. So we have these three common drugs. There are more, but these are the three common ones that are treating hepatitis C. Some of these are one pill once a day with or without food, and then some are three pills taken at the same time daily with food. So it just varies what medication you are prescribed, if you have to take it with or without food, and how many you take. With this great treatment, we also, though, see barriers such as the testing to get individuals tested, the pre-treatment screening, cost of medications. Individuals hear how much these medications cost. They're like, well, I can't afford that, so I'm not even going to bother with getting tested. So we have to break that barrier, say there are ways around that to get that drug covered. But the cost of medications is a barrier to individuals. The treatment labs, the insurance, such as lack of, the strict eligibility criteria. Used to, you had to prove sobriety for 6 months or greater. You also have the high copay. So individuals, they may be willing to take the treatment, but if they can't afford their copays, then of course that would be a barrier. Transportation issues, treatment not part of routine primary care, and then stigmatizing language. If individuals feel like they're going to be stigmatized or judged, they're not going to go get tested and full with getting treated if they feel like they're going to be shamed. A barrier that's not listed on here, but it could be pretty common is someone who is unhoused. If they don't know where they're going to lay their head down at night, where their next meal is going to come from, getting their hepatitis C treated may not be a priority. This slide shows hepatitis C treatment and insurance, the different types of insurance. So you've got Medicaid. So from January 30th, 2019 through October 31st of 2020, 23% of individuals with Medicaid were treated, 77 not, 28 with Medicare, 72% not treated, and then 35% with private insurance was treated, but 65% not treated. Now, also be aware during this time frame, we had a good about 7 months of COVID. That's when COVID hit. So that could have hurt the numbers a little bit, but this does demonstrate um, the different insurance types and the treatment amongst individuals. There is financial assistance for those with hepatitis C, like there's patient assistance programs through drug manufacturers, but currently our incarcerated population are not eligible for this. Most private insurance will cover the cost of medication, and then there's copay assistance available through drug manufacturers as well. And then Medicare plan specific and Medicaid plan specific cover cost of medication as well. So I know I went over a lot of information. Is there any questions? And is Laura, is your hand up? I'm sorry, I have different screens going on.
My my hand's not up, Melissa.
Okay.
Please feel free to come off mute, or you can also put your question in the chat. Okay, if there's not any questions, I will go ahead and let you know that I dropped a couple of great points in the chat. One are just the screening and diagnosis recommendations from CDC regarding those testing recommendations that Melissa did go over. And then also, there was a little tidbit in there about what can determine the medication for the patient and how that treatment process is evaluated. And also, preferred drug formularies and existing medications that the patient may be on can also play a role in determining the treatment course or which medication is chosen. So I just wanted to add those in there. But that was a great refresher. Rebecca Bergman actually put that in the chat as well. For those of us that are familiar with hepatitis C, it's always a great refresher just to kind of look back at the foundation and basis for why we do what we do. But for anyone that may just be getting introduced to treatment or to testing on a regular basis or seeing patients living with hepatitis C, that was a great presentation on, again, just the basics. So before we go, I'm going to allow an opportunity for anyone to ask a question related to this presentation or